Thank you for joining and welcome to our last webinar of the June series. The topic today is going to be the future of dry eye management. And before we start, I would like to introduce myself. I am Daniel Rechberger and I'm a sales manager at ESW Vision. And I would also like to welcome here with us today our President and CEO Petra Bruckmüller, and also our special guest today, Dr. Luca VIGO from Carones Vision. He is the co-founder of Carones Vision in Italy and the director of the Carones Dry Eye Center in Milan. He is an expert in ophthalmology and he specializes in refractive surgery and cataract surgery as well as dry eye management. Thank you, Dr. Vigo, for joining us today.
Very much for your invitation. Thank you very much.
Very welcome. Before we start, I would like to go through some general things as well. So the webinar is going to take 1 hour and will consist of a presentation part and then a Q&A session. I would ask all our participants to use the Q&A function of Zoom to ask as many questions as possible. I believe the presentation is going to take approximately 20-25 minutes. And then we will switch to the Q&A session and you can ask questions. That was actually from my side. I would like to ask Petra now for the introduction of the topic.
Yeah, good morning. Welcome also from my side. Through our fourth webinar in June. I had to consider because in June we started with many different topics, which was very interesting also from our side for all the attendees with interesting questions, interesting feedbacks after the webinars. We, as many companies, we also were used to install this new channel of communication to share experience with our partners, with our key opinion leaders, with our experts in technology of treatment, but also of diagnostic of dry eye. And today, within our final webinar in June, we decided for the topic Future of Dry Eye Management. The future of dry eye management is a topic which has in two directions an important impact. One's, of course, the future after the corona situation, as Dr. Luca VIGO will, I think, share some insights from his side, his experience after the first weeks after this corona lockdown in Italy, what happened with dry eye patients through this period of lockdown and what will be expected in future. But also dry eye management from a point of view, of course, of our point of view is manufacturing side, but interesting for us is also the feedback, what is expected on the market, what will be changing in the attitude, how to manage dry eyes, how to evaluate dry eye candidates, and what impact had corona in this point of view, as with or without corona, dry eye management becomes more and more important. So yeah, welcome Dr. Luca VIGO to share your experience, your expertise, and also your feedbacks, first impressions after several weeks in the meantime after lockdown in your clinic. And I think it will be exciting then to follow also after your presentation, a discussion.
Thank you very much, Petra. Thank you very much and good morning to everybody. Now I upload my presentation. Okay, here is. Okay, so yes, Petra, you're right. After the lockdown, we have an increase of dry eye patients, and we will see why. And the first thing that I can say now is that because we change the way of working sometimes, or the way of our normal activities during the day. And so we used a lot PC, monitors, tablet, and these things induced an increase in dry eye disease. And so this was the main reason for which we had an increase in this particular kind of, eye disease, that is the dry eye. But anyway, just to start, I want to remind you that the meibomian gland dysfunction is actually the leading cause of dry eye disease to the world. This, nevertheless, because of the lockdown or coronavirus, but we know that this is the main reason, the main cause of dry eye disease. And that means that the majority of patients is suffering from evaporative dry eye disease, both for intrinsic or extrinsic reasons. And why this? Because many causes are under this situation. And we know also that we are going to expect that almost 40% of the population will suffer from dry eye disease through the world in the next few years. And the 86% of this particular percentage will suffer from evaporative dry eye disease because of meibomian gland dysfunctions. And which are the causes that are under this particular situation? There are many causes, and you can see the first causes are the ones that are related to the coronavirus, for instance, because smart working, we had an increase in smart working during the lockdown period, the uses of PCs, tablets, monitors for many hours per day. This is going to increase our tear film evaporation, leading to the dry eye disease for excessive evaporation. But other causes that may increase the number of dry eye patients are the pollution. So in terms of big cities, you know that the risk of having a pollution is much higher. And also sometimes our diet is not so a healthy diet. And so and this may lead also to tear film problems. And also other metabolic or hormonal issues may cause dry eye disease, especially hormonal issues in women, metabolic in men. Another very important issue is the fact that there is a longer life expectancy. That means that we have a lengthening of life. And you know that also dry eye disease is correlated to the age. And so older people are affected to dry eye disease much more than younger people. So what we can do? I usually try to prevent the onset of dry eye disease, but the other important thing is to diagnose, to perfectly diagnose dry eye patient. And especially, we want to effectively treat our dry eye patients. So these are the three key factors that I think that we have to take in consideration every time we have to treat dry eye patients. So how can we prevent the onset of dry eye disease? We have to reduce risk factors. So we must probably sometimes ask to our patients to use less monitors or use them in better condition in terms of ergonomic positions with frequent breaks, using artificial tears during the daytime work. I personally suggest to have healthy food, so less alcohol, to eat more vegetables or fresh food. If it's possible to stay in better climate condition with less pollution, of course, but also correct use of air conditioning, so not too much air conditioning, especially during this period. And also, if it's possible, also we should less use psychotropic drugs. We know that also some kind of drugs may be the cause of dry eye disease, and especially the psychotropic drugs. If we cannot prevent 100% of the the 100% this particular disease, we must diagnose this particular disease in a precise, a complete way, using, I think, good devices and improving our knowledge about this particular disease. It is, I think it's better to do an early diagnosis, and especially if a patient comes to our office asking for something else, if we are able to diagnose a tear film problem, we should aware of this, our patient, and we should treat as well this situation before before symptoms onset. And this diagnosis should be precise, and fortunately now we have it now, and probably in the future much better. We will be we will have this much more. We will be able to detect new biomarkers like the MMP9 or the osmolarity in an easy way, in a very precise way. And this diagnosis must be complete. So we have to detect all the issues, all the topics that are in the definition of dry eye, if you want to classify our patient in a particular group of dry eye patients. And to do this, we need our personal experience, but I think that we need also an instrumental evaluation that should be fast, reliable, and especially with an automatic acquisition. You know that eSwin has the tear check that will be available on the market very soon. And usually I follow this flow chart in order to do my dry eye patient screening, my dry eye patient classification. I always start with questions, asking if there are some risk factors that can induce the dry eye disease. Then I want to check my patient symptomatology, and so I ask the patient to fill in a questionnaire in order to see why my patient is complaining a lot. And then after this, I do all my exams in order to classify my patient in an evaporative dry eye patient or in aqueous deficiency. That means the lack of having the lacrimal glands function. And after having done a good, a precise, a deep diagnosis, I want to effectively treat my dry eye patient. And fortunately now we have new products, new technology, and new instruments that help me in doing this, and will help me in doing this also in the next future. Because I mean this in all these important approaches that are the pharmacological approach, instrumental approach, and surgical approach. And we will see what I mean. In terms of a pharmacological approach, fortunately, we have a new lacrimal substitute, new artificial tears that may help our patient in reducing the symptoms, because they are available on the market. There are some lacrimal substitute with inside fat acid, hyaluronic acid, or other important elements that you can choose in a different condition, different situation, and may be much more effective for a specific patient. And also we have available on the market new topical steroids or new anti-inflammatory drugs like a new cyclosporine. Yes, we have also antibiotics sometimes that are really effective in treating the dry eye patient, especially if they have also blepharitis or blepharal conjunctivitis. We have dietary supplements available on the market. We have new probiotics. We have new night and day ointments, and now also but also in the next future will be available new drugs that may help in reducing, in treating the neurological pain that usually is correlated to dry eye disease. If we think about instrumental approach, now fortunately we have also important devices like EI that provides the IRPL treatment that is really effective in treating the evaporative dry eye, especially if correlated to meibomian gland dysfunction. We have also, and I use in my clinic, the Rexonide with the QMR treatment that is a low current treatment that helps in increasing the tear meniscus, so is effective in restoring the lacrimal gland dysfunction, and sometimes also is useful in case of meibomian gland dysfunction because it has a regenerating effect on cells and tissues. And I use sometimes also the LipiFlow if I want to disobstruct the meibomian glands. And I think that for the future, but not now, what I'm doing now and what I'll do in the future is to sometimes to do a combination of different devices if I want to have a synergy or if I want to increase my results, improve my results. And of course, yes, also sometimes we have we need a surgical approach and also new technologies, a new way of to do this kind of surgeries. I think that are really effective in treating this kind of patients, especially if this patient have also blepharochalasis or if they need a blepharoplasty. What I can say that I think that for the future, what I call the key points to success are the fact that, first of all, I think that the majority of ophthalmology now is aware of the fact that there is a strict correlation between healthy ocular surface, tear film, and anterior segment surgery. I mean, I think that I started in being interested in this particular field some years ago because, yes, I'm doing cataract and refractive surgeries, and sometimes I had not really good results, not because I had something that was bad in my surgeries in terms of choosing the lens or doing something during a LASIK procedure, but because the patient had a bad tear film before starting the surgery. And so I think that it is mandatory to try to treat our patient also in terms of tear film for in terms to lead them to have a very good tear film before doing any kind of anterior segment surgery. Because you know also that after all kind of anterior segment surgery, you have a decrease in the tear film, I mean, in a healthy tear film, because you have a decrease in tear film quality. And so I think that it is very, very important to start any kind of anterior segment surgery having a good tear film before doing this. And fortunately, now we have a better diagnosis, a very accurate diagnosis. We can prevent sometimes this kind of bad conditions. And as I told you, we have fortunately also effective treatments that can help our patients and ourselves, of course, to have a very good results. And I think that another important issue is what I call the patient education. I think that we have to teach our patient how they can continue their therapy at home, and they can evaluate their situation in connection with me, with the ophthalmologist, through specific apps that now are available on the market. And to do this, what I'm doing and what I'll do in the next future is what I call the dry eye spa in our clinic. So what I ask the patient to come in my clinic saying that they can have a dry eye spa where they can have a complete treatment in terms of pharmacological, instrumental approach, and where they can be educated, where I can teach them what they can do at home in order to maintain their good condition. And to do this, I offer what I call a dry eye package that is, in terms of cost, it is a complete package of diagnosis, treatment sessions, and the follow-up visits. I think that this is very important because my patient is very happy to hear this, because I think that also the patient confidence is much higher and increased a lot. And so this is what I'm doing, and what I think is very important for the next future, to treat dry eye patients. And I think that I can stop. I thank you for attention, and I'm here to answer your questions. Thank you very much.
Very interesting again to share your experiences and your feedbacks. Conclusion from your side, Luca, and also regarding our topic today, the future of dry eye management. What would be your expertise, your recommendation to summarize a bit in terms of future dry eye management, especially for our attendees?
I think that first of all, the majority of ophthalmologists should take in consideration and should be interested in this particular field of ophthalmology, not only because there are a lot of patients that will suffer from dry eye disease in the next years, but so not only in terms of revenues that you can get from these patients, but also because there is really an important correlation between dry eye and anterior segment surgery, especially if you want to treat your patient using multifocal IOLs, or doing a LASIK procedure, or using a phakic IOLs. I think it's mandatory to treat the patient only if the tear film is good and not really bad, especially at the beginning when you do the surgery. I think it is very important, not only for legal issues that you can get from after the treatment, after the surgery, but also because the patient, I think that must be happy after the surgery, and not only for the results in terms of refraction, but also in terms of quality of vision. And the quality of vision is strictly correlated to a good tear film. So this is the first thing. Second, I think that fortunately now, and probably better it will be in the future, we have very good devices in terms of diagnosis, in terms of treatment. So you have to invest probably in these particular devices, because I think that it's not enough our personal experience, and the patient needs something else in order to have a better compliance and in order to have a better results. So I think that it is very, very important to have good devices like, for instance, the tear check that may help us in doing the diagnosis, and having good devices in doing perfect and having effective treatment of our patients. And I think that these are the main factors, the main topics that are really important and will be very important for the future. The last one, but not the least, is the fact that now we will be able to connect with our patients, probably, if not every day, every week, through specific apps. You know that in our smartphone, we can download a lot of apps, applications, and some of them may help our patient to be connected with us. And this is very important for you, the doctor, and for the patient, because I think that if he can see that he can fill in his symptoms, and he can check his situation constantly or every week, and you can see how it's going on. I think it's very, very important. And this is another way that we can manage this kind of dry eye patients.
Great. Thank you for your summary on recommendation. Thank you also, Luca, to join this webinar. Again, very interesting to share. And yeah, thank you to our participants. I think time already passed, and I can expect that you, I can imagine that you switch back to surgery, right? Yeah.
Yes.
Okay.
Thank you from my side, and to all of our participants, and especially to you, Luca, for joining our session today and for sharing your valuable insights into the topic of dry eye management.
Thank you very much, Daniel. Thank you very much, Petra, and see you soon, I hope.
See you soon.
For listening.
Yeah.
Thank you very much, everybody. Bye-bye. Have a good day.